Welcome to Chillin' 101. We hope this video helps.
You begin right now. Confirm the surgeon's prescribed range of motion and session length because the machine must match orders. Place the leg supine, heel centered on the footplate, and align the knee with the machine hinge. This prevents twisting. Once positioned, secure the straps snug but not tight. Make sure dressings and any drains or Roman IV lines are clear of the device. Turn the unit on and set the initial range to the low prescribed start, so movement begins gently and safely. Once the device is running, increase the range gradually as instructed. Move from the starting degrees toward the target in programmed increments. This protects repaired tissues. Adjust speed and hold times. Slower cycles reduce pain and muscle guarding, while short holds can improve tolerance. Make sure you monitor pain, swelling, and skin integrity continuously. Check straps and pressure points. If you notice increasing redness, pins, numbness, or uncontrolled pain, stop the session and When you finish, slow the device to neutral and power it down before loosening straps. Support the limb as you remove it to avoid sudden flexion. Record the session details, total duration, maximum achieved ROM, pain level, and any concerns so your care team can adjust therapy. If the machine alarms, moves erratically, or causes sudden jerks, stop immediately. Unplug it. Inspect setup and hinge alignment, then contact your clinician or the supplier. Avoiding forced use prevents injury and protects the repair.
Thanks for watching. Consider subscribing if we helped you.